My name is Erik Blutinger. Today is Tuesday, April 7th. I'm an emergency physician at Mount Sinai Queens Hospital. I just hopped into the car and about ready to drive into work. Usually I take the subway, but because of the spread of COVID here in the city, I chose a rental car because I thought it would just be a lot safer. I'm a little bit anxious going into work. I don't really know what today will be like. Every day is like a jack in the box. And today I've heard from a few colleagues that things are still status quo. Today I know Governor Cuomo announced that we potentially are getting close to the plateau phase, or at least the peak, but it's really hard to see that day to day just given the extreme volume and acuity of our patient population. Okay, so I'm now walking to the hospital. The weather is beautiful outside, but it is such a paradox because of how frayed and anxious this community seems to feel here in Queens. Parks are still closed. Some people are walking outside, but they are certainly keeping their distance. One of the things, in fact, a lot of my mentors told me that first year out of residency would be tough and super challenging. Never in my wildest dreams could I imagine practice clinically out of residency as my first year as an attending, having to deal with this mess. But we're pushing through. It feels inspiring going into work and fighting off the wolves. I'm about ready to walk into the ED, and we'll see what the situation's like. I heard that our volume is just exploding, and we have so many people in the hallways that are all COVID positive. All right, so as I'm getting ready to prepare my workstation, I literally am just Clorox bleaching my entire desktop, including the keyboard, to avoid contracting this virus. Things are just totally crazy right now. Everyone is COVID positive in these hallways. All you hear is oxygen. I'm seeing young patients, old patients, people of all age ranges who are just incredibly sick. And you can even hear it now that as I'm walking through patient rooms in the hallway, you just hear oxygen, the sound of the pulse ox. I'm going to see if I can find some people here who can share some of their thoughts on the situation. This is Dr. Ezenkwel, who's our chair.
Howdy. How's it going here?
Just leading a quick walkthrough through the department.
Yes, I understand.
How are things going today?
It's going busy. It's pretty what we've been expecting and seeing all along. We've seen a lot more patients, and they're critically ill, and we're doing our best to keep track and keep on top of them and make sure that we can provide oxygen for them, some positive pressure, and if needs to be, we intubate. But this has been the story for the past week or so, and it's just getting progressively worse. But everybody here in the staff is doing extremely well and working hard.
So I'm now walking into the critical care room. In the critical care room is where we have our sickest patients. Just wanted to show you some of our equipment. So this is a ventilator machine. We keep it protected with plastic covering just to make sure it does not get contaminated. We have our suction, we have our oxygen, we've got our monitor. I've never seen us have an empty spot in the critical care bay, but we try to make sure that we at least have space for one more emergency that comes through our door. This is where we keep all of our airway supplies. We're stocking it now. How are we doing with airway supplies?
We are great. We have everything we need.
We're what?
So we have everything that we need for airway.
Perfect.
Yes.
Everything that we need for airway. So we're focused and we're ready, no matter how hard it is. All right, so I'm taking a step outside. Sun. This is the brand new tent that we've set up. It's meant for surge, which means patients for which there is no space in the emergency department will come in here. You'll see two big tents. We have it very well demarcated, and we'll go inside just to kind of take a look. All right, so this is one of the tents that we are about to get up and running. As you can see, there's a registration desk, and as we kind of walk through this tent, we've got a huge range of supplies. Each room is kind of cornered off with telehealth capability where a provider will be on the other end remotely providing guidance. We have curtains separating each of the rooms. It's very well set up, looks very clean. We have a big, huge cabinet of supplies, IV materials, blood pressure cups. We've got urine cups, and plus a ton of other resources that I just won't be able to show you yet because they are in the process of bringing them inside. And you can even see there is really good insulation and everything is well contained in this closed space. As we're getting this tent prepared, we're going to walk out. You can see we've got a ton of oxygen tanks here ready to go, and we're about to walk into the second tent that now has patients. And we're just walking through. So as you can tell, we've got patients in each bed lined up. We really have some fearless staff. Everything is closed and confined. I wanted to check in midway through my shift, and there's a lot of really dark, difficult cases being handled right now in the department. But one bright spot in the day is the fact that the hospital announced that anytime a COVID-positive patient gets discharged, they would be playing a piece from the Beatles song, "Here Comes the Sun," on the loudspeaker. And actually, at one point today, I did hear it, and it kind of goes like this. And it's actually one of my favorite Beatles songs. So it's great to see that even though the prospects are quite dim and there is a lot of distress and despair in the community and in our hospital, there are bright spots that can be extremely powerful and uplifting throughout the day. So I get a lot of questions about how do you swab for COVID. The way you swab for COVID is you take one of these, which is a viral swab, and essentially have to dress in the full PPE gear, which is what I'm doing. Once you get fully dressed with head, eye, nose, mouth protection, you essentially have to take this small tip, very tip of it, and you insert it into the patient's nose. You quickly, it's a very uncomfortable feeling, and patients often hate it. But once you take the very tip of this, you stick it up in the nose, and then you insert it into this lid red vial, send it to the lab, and within only a few hours is when we get the result back. So I'm about to do this on a patient who's being admitted to the hospital because we have to ensure that the patient does not have COVID, and if he does, or she does, then they deserve to be in special isolation room and extra cautions upstairs. So I just finished my shift. Here comes the fun part, which is decontaminating my entire body, including the things I'm wearing and washing my face. But one thing that I did take away from this shift and noticed in particular is that a lot of my patients who are super sick are actually male. I did not have a lot of female admitted patients, which kind of coincides with some of the recent news reports in the New York City area that seem to suggest that male patients tend to be more frequent on the sicker end as opposed to their female counterparts. So I'm going to pack up, get everything together, and think on my drive home, like I do every night, of what more I could be doing to help fight this crisis and what cures are possibly out there and what next study is going to come out that will give us more of a direction in fighting this awful enemy. This disease seems to permeate every aspect of life. I just walked into my building and was speaking to the doorman, and he just told me an awful story where his best friend, a 34-year-old male, who has 3 kids, including a 7-month-old, passed away today. He has no medical problems, and he died after spending a week in the hospital and returning home finally yesterday. But the worst part about it is that the funeral home has no more space in Queens, at least the one that he wanted to go to. And funeral homes are filling up because of how many people are rapidly passing away. So I just wanted to share with you that story because it kind of illustrates how even when I'm away from the hospital or leaving work, no matter where I go, it's on everyone's minds. And every day, I'm sure thousands of people are hearing countless stories of tragedy.